Hello, I'm Dr. Vikas Gupta, Director Hand to Shoulder Clinic. Today we'll be talking about tennis elbow. Tennis elbow is a generalized term, but actually what happens, the muscles which are extending our wrist, which are attached to the elbow, they undergo some kind of a tears or small tears, which could be degenerative or traumatic, and because of which whenever we extend our wrist, there's a pain at the elbow. So we'll be talking about it. What is the treatment? As we have seen pathology of tennis elbow, there are micro tears which are happening because of the trauma or degeneration. I'll bring this elbow. This is the elbow, this is the shoulder, this model, in which it is showing that this is the place where our muscles are attached of the wrist extensors, from where the tear occurs. Usually most common site of tear is on the outer side of the elbow, or I can show it on the elbow. That pain occurs most of the time on the outer side of the elbow, and it increases whenever we are doing this movement, extension of the elbow. So treatment goes in three ways. First is conservative, that is physiotherapy and some medicines. If they don't work, then we go for injections. Injections are usually steroid. Nowadays we are giving platelet-rich plasma also. In steroid injections, the relief is almost immediate within 2 to 3 days. But whenever we are injecting PRP, it takes longer time, from 6 weeks to 3 months. But if patient is refractory to all kind of treatments, then we have to do surgery. But before we talk about surgery, I'll invite Dr. Sheetal. She's an occupational therapist in our clinic. She'll tell us something about exercises which can be done at home after tennis elbow. So Sheetal, could you tell us what are the exercise, or what do you recommend for what patient should not do, what kind of heat therapy, cold therapy they should do?
Okay, in tennis elbow, first of all, if it is in the acute phase at the beginning, you should always take a cool pack. You can take the ice in a towel, wrap it and do the cool packs, or you can buy the cool packs from the market and keep it in a fridge and apply them over here. And if it's a chronic one, then you should go for a hot pack. You can even go for a contrast bath, where you can keep for half a minute in the warm water and for 1 minute in the cool water. Then secondly, you should immobilize the joint. You should not do any activity like opening the cork, opening the bottle, opening the lock. You should not do the twisting of the fingers like this, where the muscle is twisted, as it is already inflamed, so it will be painful. You should immobilize it. You can buy a tennis elbow band which is available in the market. You can always apply it by placing two fingers at the elbow joint, and then where the gap is, after the two fingers, the gap left, you can apply the tennis elbow band and you can immobilize it. For exercises, once the pain is reduced to 50% or you're comfortable, then you can do stretches. You can stretch your wrist like this, or you can stretch it like this, and you can give a count of 10 and then relax. Again a count of 10, relax. You can do 10 to 15 times in a day.
Thank you, Dr. Sheetal. So this is a very simple method which can be done at home, but sometimes not all patients are responding to it, and we give injections, then also patients don't respond to it. So there is like 10 or 8 to 10 patients which do not respond to these kind of methods. For these patients, we do surgery. There are two types of surgeries we do. One is open surgery, one is arthroscopic surgery. In the surgery, basically what we do, we debride and release the degenerative torn part of the tendon and allow it to heal slowly. So even after surgery, physiotherapy has to be done from 6 weeks to 3 months. So what are the indications for open surgery or arthroscopic surgeries? Usually it is more of a cosmetic reason, but in the arthroscopic surgeries, it is a minimally invasive, incision is small. In the open surgery, incision is little bit big, but on the whole, the incision is around 2 centimeters. So there is not much difference, but some people would like to get arthroscopic surgeries, which is okay with us. We ask the patient, give them the options. Whatever patient chooses, we perform surgery accordingly. But one should always remember, surgery is required on only 8 to 10% patients. So patient has to be really patient and we know that 90 to 92% patients will get relief from physiotherapy and injections, and I think that should be tried first diligently, and patients will get results. Thank you.